Well, hello, everyone. I hope you are having a great day wherever you may be. My name is Lindsay Streeper, and I'm the Senior Director of our Marketing and Communication team here at Magellan Federal. And I'm going to be your moderator today for our webinar on autism resources for military families. If you're new to Magellan Federal or our MFed Inform series, welcome. We are glad you're here and you've joined us today. MFed Inform was created to share the expertise and insights that we've gathered from delivering health and productivity solutions to the federal government. We share these insights on our blog, and you can get to it by going to the URL you see at the bottom left of this screen. It's mfed.info/inform. And once you get there, you can subscribe to our blog, which is a great way to get alerted to any new resources we've posted and have available, such as webinars like this. And all of our resources are free and open to the public. So before we get started, there are just a few things I want to cover. The first portion of this webinar will be devoted to the wonderful content that our panelists have prepared for you today. And at the end, we will take your questions with any remaining time that we may have. The webinar is being recorded for future on-demand viewing, and all registrants will receive the replay after the call, and it will also all be posted on our blog. Your lines are muted throughout today's session, but you can feel free to ask any questions you have by going to the Q&A at the bottom of your Zoom window and typing them in there. If you are dialing in, I do encourage you to submit questions to our email inbox, which is also listed before you here on the slide. That email is mfedinform@magellanfederal.com. And these are going to be answered at a later date. So thank you all for joining us, and let's get started. Next slide, please. Before we dive into the agenda and what we're going to cover today, I wanted to provide a brief overview of who we are. Magellan Federal is a government contractor with headquarters in Arlington, Virginia, and our team members are all over the world at government installations and agencies delivering sensitive, complex wellness services. Our mission, as you see here on the slide, is to inspire healthier, more productive communities by delivering innovative, total well-being solutions to the federal government, military personnel, government employees, and their families. It's a wonderful mission, and it's what has given me pride to be a member of the Magellan Federal team for nearly 13 years. We deliver service and staffing offerings in areas such as mental health and substance abuse, family support, fitness for duty, wellness, coaching and care management, veteran benefits, and various administrative professional services as well. So that's a little bit about us if you're new to us. Let's go on to the next slide so we can cover the agenda of what we're going to be talking about today. Thank you. So April is Autism Acceptance Month, and it is also Month of the Military Child. So we thought that was a great opportunity for us to share with you information and resources available that merge both of these topics to really support military families with children on the autism spectrum. So today you're going to hear from several panelists, and all are members of our Magellan Federal team supporting either the Exceptional Family Member Program, which we call EFMP, or the Military and Family Life Counseling Program, which we call MFLAC. So in our time today, we're going to cover a general understanding of autism, what that may look and why it may look and feel a little bit different if you're a member of the military community. We will hear a testimonial from one of our EFMP systems navigators on her personal experience being a parent of a special needs child while managing the obligations and challenges of being a military family. Then we will dive into the programs available to military families to reinforce the continuity of care while in the military. And these are the MFLAC and EFMP programs that I mentioned. We're going to dive into those, which we actually help staff and execute for the government. And finally, we're going to wrap with tips and takeaways. And of course, we'll have time for Q&A at the end. So whether you are a professional or a parent, there's going to be something here for you today. So let's dive in with our first presenter, Lynette Wishart.
Hello, my name is Lynette Wishart, and I am a licensed clinical marriage and family therapist, certified autism spectrum disorder clinical specialist, and a supervisor for the MFLAC program since 2014. I'm also a parent of a child on the spectrum. Let's take a minute to define what we're exploring today. Professional theories about childhood disorders have shifted over time to better capture what we now classify as autism spectrum disorders, which impacts the social, communication, and behavioral areas of living. Causes and treatment continue to be put forth to capture pieces of the mysterious puzzle. Though common symptoms persist, each person with ASD experiences a unique level of impact on intellect and functioning, and even symptoms of siblings affected can vary widely as it tends to run in families. Some distinguished originals that fall into this population are Albert Einstein and Thomas Edison, Beethoven and Mozart, Emily Dickinson, and Jane Austen. According to the CDC, currently about 1 in 36 children are diagnosed with autism, with boys being 4 times more likely. Professionals have theorized that girls may be more likely to compensate by masking their symptoms, resulting in a misdiagnosis or being misdiagnosed. Girls may have subtle symptoms or higher functioning and do not always exhibit characteristics according to traditional testing markers. The 5 major types falling under the ASD umbrella are Asperger's, Rett's, Kanner's syndrome, childhood disintegrative disorder, and pervasive developmental disorder. It's common to see additional disorders diagnosed, such as ADHD, dyslexia, or slower processing, which can complicate the individual's learning process. Other concerns affecting this population in higher numbers are bullying, self-injurious behavior, anxiety, depression, schizophrenia, and various health issues or physical disabilities. Asperger's high-functioning autism is seen in those with high levels of intellect in some areas and deficits in others. The term masking refers to sophisticated compensation skills where one observes and mimics the social skills of others, replacing natural tendencies. The invisible edge, a term coined by Asperger's specialist Tony Atwood, describes it as flying under the radar, resulting in either a late or a misdiagnosis. Next slide, please. The American Autism Association offers early warning signs. In the area of communication, we might see delays in language development, quirky repetitive language or sounds, inability to initiate or maintain speech, responding by repeating a question rather than answering, or difficulty communicating needs or desires. With social interactions, we may find lack of appropriate verbal or nonverbal behavior, lack of ability to develop friendship, social and emotional exchange challenges like eye contact, minimal tolerance to being touched or held, trouble perceiving and talking about feelings. In the area of patterns of behavior, we may see restricted or repetitive behaviors, difficulty in motor control, distress with change in routine, peculiar connection to objects or lining up toys, head banging or rocking back and forth, and sensory sensitivities. Now I'll pass it over to Keone, who will take us deeper.
Hello, everyone. My name is Keone Trainer, and I am the Exceptional Family Member Program Instructor. Ms. Alette has given us some great insight into autism. Some examples of these areas of development that she discussed are commonly affected by children with autism would be speech and language development. Abnormal speech patterns are very common in children with autism. For example, if you teach a child with limited speech to say phrases like open door, they might overgeneralize it and say open door, even when they want you to open a bag of chips or a bottle of water. Also, we have social and emotional development. Children with autism often struggle in reading and responding appropriately to others. Emotions. It is important for everyone to understand that a child with autism isn't intentionally being rude or uncaring. They simply don't have the skills to understand. For example, common individuals with autism often struggles with understanding and paying attention to facial expressions. They may scan a person's face in a different way than their typical developing peers. Normally, the first thing a person focuses on is an individual's eyes, and then they move on to the rest of their face. A child with autism may focus only on the person's mouth, which offers less emotional information than the eyes. Cognitive development. This is another example that you will see. If you see your child is struggling putting together a puzzle, offer them different ways to solve the problem for themselves by providing them with choices and prompt them to make thoughtful decisions. This allows for growth, and it helps them look like they have control over what they do. Now that you have gained some insight into autism, you may be wondering, how does this relate to the military? Well, I will let our next presenter, Ms. Amy Leeser, share this information with you.
Thank you, Keone. Hi, everyone. My name is Amy Leeser, and I'm a licensed professional counselor in the state of New Jersey. I'm currently a regional supervisor for Magellan's Military Family Life Counseling Program. Next slide, please. Overall, as Lynette had shared, that 1 out of every 36 children will be diagnosed with autism in the general population per the Centers for Disease Control. In 2020, TRICARE reported across all branches of service that 34,361 military children were diagnosed with an autism spectrum disorder, with about 60%, 20,735, being children of active duty service members. It is suspected that these numbers are significantly underreported. The road to diagnosis is long, and families are not represented in this number as they are working towards a concrete diagnosis. Many children are evaluated and treated for warning signs or symptoms with treatments such as speech therapy and occupational therapy prior to receiving the autism spectrum disorder diagnosis. A diagnosis can be the key to opening doors to supports and life-changing treatments for families. Most military families move every 2 to 4 years, requiring parents to establish new care providers for their children once they arrive at their new location. These moves, known as permanent change in duty station, takes a unique toll on the military child with autism. For children who require specialized care, it's even more daunting. After months of working to either find or establish treatment in their current duty station, they are required to, quote unquote, move and go back to the end of the line once they relocate. Friendship and social interactions are protective factors for overall mental health. Military children move frequently and must make new friends at their new hometown and school. Autistic children innately struggle with making new social connections, which makes it particularly harder for them to establish new positive social connections with peers. Autistic children were reported to be lonelier and more withdrawn after relocating to their new location. Deployment cycles lead to increased behavioral and emotional issues for military children. Parents have reported that once their child's problematic behaviors have stabilized after the parent has been deployed for some time, their behaviors may increase once again once the parent returns from deployment. Children exhibit increased emotional withdrawal and repetitive behaviors when their service member parent is deployed. These behaviors return during reintegration period and require additional patience and support on the already depleted and exhausted family system. During deployment, the custodial parent is left to manage the care of the entire household. Research states that military spouses, parents, feel guilty and worried about providing adequate parenting alone. Military children whom have siblings with autism also experience unique stressors. These siblings empirically have shown higher tendencies of experiencing loneliness, academic struggle, and aggression. Many report feeling high sense of responsibility and duty to their families and their siblings with autism. Now I'd like to turn it over to Christy, who's going to give a personal experience sharing about being a military family and serving with their child with special needs.
Hello, everyone. My name is Christy Pendergraft. I currently work as a Magellan Federal Systems Navigator for the Army Community Services Exceptional Family Member Program at Fort Stewart. I have been a family member, a military family for over 30 years. And in that time, I have been a part of 4 permanent changes of station, as Amy had stated, and a combination of 8 deployments. If we could go ahead and go to the next slide. So flexibility when you're a military family is very important, but for a family with special needs such as autism, flexibility does bring additional challenges. My family personally experienced some of those unique challenges. It was almost as if we had followed the stages of the grieving process. At first, we felt like there was something that may not quite be right with my family member, but there was so much going on at the time, as Amy had stated, with deployment or absences from the parent, that we just really didn't focus on the lack of speech or communication too much at the time. We thought maybe it was the instability in the home that had maybe been bringing some of those sleeping issues or behavioral issues. So once life started to slow down a little bit, we did start to question those things. Those questions started popping up. Is there something really wrong? My family member was maybe not speaking as well as a sibling or cousins that were around the same age. And then, the denial, we couldn't really tell if what was going on is something that was real or something that was just a concern or would grow out of. So we didn't know if we should have it addressed by a pediatrician or a professional or not. Then when we realized that this is something we need to address, we did go ahead and seek professional help with the evaluations through the pediatricians, just to see if it was really something, or if it's something that maybe would grow out, or like I said, be easily fixed or taken care of or treated. So we did see the pediatrician who gave us referrals to the specialists. We did have a lot of mixed feelings. I personally had a lot of mixed feelings at the time about labels and things. I remember just being really defensive and hoping that the concerns were either just temporary or something that, you know, would be grown out of. We received the diagnosis, and then we got the therapies for referrals. We did a lot of ABA therapy. We had a communication board. We learned some simple sign language. We thought we were really making progress. The focus then kind of shifted on was there a concern? And then, okay, now how do we navigate? How do we live like this? What does life look like? In the midst of all of the changes in that. So we didn't really know too much about the Exceptional Family Member Program at the time, but they did offer some resources and referral information, mostly education pieces from that program. But we did use a lot of the military family life counselors at that time for several of us for different points in transition, for myself personally. And then, like Amy said, the siblings in transitioning in and out of the home, and then just learning how to navigate this new diagnosis, and how do we grow and learn and develop. So for my family, one of the hardest things was that transition piece for everybody in the home. As Amy said, it's on the way out and on the way in. There's just so many things that go on. And every time it seemed like we got established and we got services going and we felt like we were on a good roll with things, something would happen. We would PCS, changing to a new station and move, or there would be a deployment or something along those lines. And then it just felt like we were starting all over. I think Amy said, back to the end of the line feeling. So that's frustrating in itself. So I currently work, as I said, as a systems navigator, and I do know firsthand what some of my families are going through when they learn that their child may have ASD. Like my family, some of them are going through similar stages just to reach the acceptance of the diagnosis and seek out the services and resources. So I try to understand where they are in their need for support, and then just offer them any information that, if it's just information referrals or navigating the systems. So I think you'll hear more about the actual EFMP, the Exceptional Family Member Program, and TRICARE ECHO later in the presentation. The military family life counselors are so versatile for all family members, especially during those transition times. But for kiddos with ASD, and even in my experience and the line, they can be especially helpful in integration to new schools and treatment providers, even changes in their homes. So I did use Inflex a lot. Advice to families: utilize your resources. The program is there, the resources are there. Please utilize your resources. You are not alone. The whole mission of family support is to be there to help you through those challenges, especially when your service member is focused on their mission. So that's all I have. It was a great experience. I wouldn't trade it. It was difficult. There were a lot of ups and downs, but I think it made me a better support system through family programs. So I believe our next speaker goes back to Amy for military family life counselors, and Melissa Ram, who's going to talk about the Exceptional Family Member Program.
Thank you, Christy. So back to the Military Family Life Counselor Program. Next slide, please. So created in 2004, Magellan's Military Family Life Counseling Program has 1,477 counselors from east of the Mississippi River in the United States, across the pond to Eastern Europe. Military Family Life Counselors, or MFLACs for short, are located across military installations and child development centers, after-school programs, units, schools. They serve adults, couples, families outside of these locations. They provide walk-around confidential non-medical counseling without maintaining written notes. While there are limits to confidentiality, these services are valuable in the military community, where the stigma of seeking mental health support can be a detriment to the career trajectory of a service member. MFLACs can provide not only counseling services to service members and their dependents, but also psychoeducation and consultation to stakeholders in schools, youth programs, and command. Next slide, please. Military family life counselors can be mission partners, a help multiplier for those special families. MFLACs can serve as referral linkages, connecting families to services locally or at their next duty station prior to their move. MFLACs may assist in a smooth connection to autism resources for military families from one base to the next. Although MFLACs do not provide direct support for the child diagnosed with autism, their families may benefit from the non-medical counseling support. MFLACs can provide support through individual, marriage, and family counseling. Utilizing the current military family life counseling network of counselors, resource lists can be maintained locally and available to share to their counterparts at other installations across the Magellan Federal footprint. MFLACs can also connect with can also connect with local exceptional family members program, EFMPs, to provide MFLAC briefings and presentations to families currently within the program, advising of support that can be provided to the family unit. Although the child with exceptional needs is out of the MFLAC program scope, the parents and siblings are not. MFLACs can also assist with direct support of the siblings of the children with autism. School MFLACs have particularly great advantage in identifying and serving these unique children. MFLACs situated in middle schools and high schools may be instrumental in providing support for these children. I'm going to turn it over now to Melissa Ram for further information about this EFMP program.
Hello, my name is Melissa Ram, Exceptional Family Member Program Manager. As others have stated, military families with special need family members, also known as exceptional family members, often require additional help in meeting their EFM's needs. To support families with special needs, the Exceptional Family Member Program was created across all military branches. However, I will focus on the Army's Exceptional Family Member Program since it is the program I manage. The Army designed EFMP to be a comprehensive, coordinated, multi-agency program that provides community support, housing, medical, educational, and personnel services to military families within EFM. Approximately 10% of Army families have members with special needs, including spouses, children, or dependent parents who require special medical or educational services. The government supports these families within EFMP through 3 pillars. One is Medical Command, which works with families to coordinate identification and enrollment in EFMP. Human Resource Command, which coordinates assignments while ensuring that special medical and educational needs of family members are considered. Family Support Command provides education so families can make informed decisions as well as assist families as they advocate for their EFM. They provide tools and programs so families can remain connected and have updated information regarding EFMP. 2 examples are the EFMP and Me page, which is a virtual self-service website, and System Navigation, which Ms. Trainer will discuss later. So how would you enroll in EFMP? Well, first, you must meet with your medical provider to see if you or your dependent qualify. Your provider will give you forms to complete and to give the EFMP case manager. Second, the EFMP case manager will review paperwork and advise if modifications are needed. Finally, if information is correct on the form, the EFMP case manager will forward the information to RHC for approval. Magellan prides their support in supporting the Army by providing system navigators in 32 locations around the world. System navigators can be found at Army Community Service Centers or military family readiness centers if you live on a joint base. You can also contact Military OneSource if you need assistance locating a system navigator, or you can research the EFMP and Me page. These resources can provide you information regarding EFMP for other armed services as well. Next slide, please. One of the many benefits of being enrolled in the EFMP program is having access to the TRICARE Comprehensive Autism Care Demonstration. The ACD covers applied behavioral analysis services. Under the ACD, applied behavioral analyst services are authorized to target the core symptoms of autism spectrum disorder. In order to receive services from this program, you must be enrolled in EFMP and extended care health options. To enroll in ACD, you must do the following. Step 1, get diagnosed. You must see your primary care physician or an approved diagnosing provider. Step 2, get a referral and a pre-authorization. You must, or your child must get a referral to the ACD and a pre-authorization for all ABA services. All TRICARE plans require this. Your child's diagnosing provider will submit a referral to your regional contractor or U.S. Family Health Plan provider for authorization. Your child will get an authorization letter for 6 months of ABA services. Step 3, complete outcome measures. You and your child's provider team must complete 4 baseline outcome measures before your child can get ABA services. This will help monitor your child's progress. You must complete the 4 outcome measures every 6 months or every 12 months. Step 4, schedule an appointment. When you get your child's authorization letter, schedule your child's ABA assessment appointment. Your child's authorization letter gives you the provider's contact information. Finally, step 5, work with your autism services navigator. TRICARE will assign your child a ASN. Your child will only get an ASN if you're new to the ACD. Your child's ASN acts as the primary care coordinator. For more information, please visit TRICARE or the EFMP and Me page at the links below. Now we'll go to Ms. Trainer for tips and takeaways.
Well, thank you so much, Melissa. I appreciate that introduction. Well,
No
throughout this
problem.
webinar, you've heard some important information about autism, information on how those with autism communicate through speech and gestures, how they interact with those around them, and how they are a part of the military community. What you haven't heard is how important advocacy is for those with autism. Here at Magellan Federal, our systems navigators pride themselves in being the support factor for family members with special needs. What is a systems navigator? What is their role? Systems navigators facilitate connections between military families who have special needs and the systems of required care. Autism is one of the many disabilities that our systems navigators assist family members with on a daily basis. Their main goal is to empower family members with special needs to self-advocate for themselves. Some important tips and takeaway information that I would like for you to remember is that systems navigators, like Melissa said, are on Army Community Service Exceptional Family Member Program staff members are located at most of the Army installations worldwide. They are trained and knowledgeable about the systems of care used by families with special need. Their primary role of a systems navigator is to navigate families through the available systems of care, both on and off the installation. Tidbit: if there's no systems navigator in your area, we have USAREC systems navigators, which are able to assist those that does not have a military installation around them. All right. Systems navigators identify exceptional family members and the family strengths and needs by communicating with the families, conducting home visitations, and meeting the families where they are in their understanding process. Systems navigators help identify and prioritize family goals by developing a family service plan. This allows the systems navigator to help guide the families to reach each target goal that has been set in place. Next slide. Systems navigators empower military family members with special needs to self-advocate for themselves. They provide them with the tools, rules, regulation, and above all, the support to be their own best advocate. Systems navigators make referrals to required services such as TRICARE approved applied behavior analysis, which is ABA. All right, ABA therapies involves many techniques for understanding, predicting, and changing behaviors. They help those with autism adapt by meeting the needs of each unique person. Systems navigators also informs families that this form of therapy is not the only option. Autistic children do not need therapy simply because they're autistic. Instead of asking, what should I do instead of ABA, ask yourself, what specific needs does your child have? Alternatives are, if your child experiences distress and meltdown due to sensory sensitivity, try occupational therapists that specialize in sensory regulation. If your child struggles with motor coordination, try a physical therapist. Those are just some of the tidbits of information that a systems navigator would provide our military families with. Systems navigators also identify and coordinate workshops, support groups, and social activities that are beneficial to the families. Relevant workshops and support groups help spread awareness of topics such as autism. The goal of the workshop is to provide educational information to teach key skills to students with autism, parents, and professionals. Some of the many workshop topics are: what is the most effective intervention for autism? And how can a non-autistic person better understand what it's like to be autistic? Topics like this aids everyone within the community to have a better understanding. Also, support groups, which has two main functions. They provide families and caregivers with needed information on a variety of topics related to autism. And just as important, they provide interpersonal support so that parents, caregivers do not feel isolated or alone. Some of the support group topics are supporting those with autism during deployment, and open topics, which are my favorite. This allows a family to discuss any pressing issues or thoughts or concerns in a safe, open environment without feeling judged. Above all, systems navigators strengthen the family ability to self-advocate for their exceptional family member. Systems navigators support and empower the families to promote and protect the rights and welfare of their loved ones. Encourage individuals to communicate their wishes and views. This can be a parent, a guardian, or the exceptional family member themselves. They discuss how important reasonable accommodations can be for those with autism. When requesting accommodations, it is essential to be reasonable. For example, it may not be feasible for a person with hearing sensitivity to ask for a manager to lower the volume at a movie theater with other people. However, there are different ways to accommodate this person, such as have them ask for earplugs or headphones. This is just one of the self-advocacy skills that a systems navigator will demonstrate throughout their time with their family. Now that you've heard about how beneficial and absolutely amazing a systems navigation service can be to families, I would like to present our next speaker, Ms. Lynette.
Thank you. As we keep in mind the tools and resources available, let us also look at how to respond compassionately to children and caregivers living with autism. Due to distinctive brain patterns, emotional outbursts can be frequent, which can be challenging for caregivers to manage. It is helpful if the adult remains calm and models good coping skills from which the child can then draw to self-soothe. Using verbal cues, distractions, or the special interests of the child, like reading or playing with cars, can help calm the child. Rising voices and increasing tension can inadvertently prolong periods of challenging behaviors. Bearing in mind that lacking communication and verbal skills makes it difficult for the child to make their needs known, attuning regularly to the nuances of the individual offers the adult a greater ability to notice triggers and needs in order to respond appropriately, which may even work to help prevent outbursts. Using patience and curiosity to know the child better can go a long way towards understanding motivations behind anxiety and frustrations. Caring for children with autism can be quite physically and emotionally demanding for caregivers. Asking for help and finding support can make a significant difference over time. When parents are stressed, it can be hard to be their best self for their special needs child and the rest of the family. Marriages can suffer as a result. Self-care for the caregiver is a necessary survival skill. Utilizing resources like respite care and building a team of professionals around the child can help them build life skills and relieve the caregiving load. Next slide, please. Temple Grandin, a well-known author living with autism, likes to say that when you meet one person with autism, you have met one person with autism. It is vital to keep in mind that these individuals can be highly compassionate and quite gifted in areas of aptitude, enjoy life, and lead productive careers. The unique giftings and personality of each individual is an intricate tapestry to appreciate. Now I'll turn it back to Lindsay for some Q&A.
Thank you, everyone. That was really, really informative and interesting. So thank you for sharing your stories and your insights. I'm going to have Kaylee close up the presentation. I'll have you reopen it, Kaylee, at the end when we close it out so people can see the blog again, but I will share the grid view so you guys can put in your questions there and we'll get to the Q&A. So let me have all of us visible here. So this is your panel that you can ask questions to. We have been answering some along the presentation along the way. So hopefully you've gotten some of your questions answered. I'm going to start with addressing some of the questions that came in during the registration process. So you were asked when you registered for this webinar to ask questions of the panelists. So we had a couple good ones come in that I wanted to address with the team. So the first question was, how do you explain to others that don't understand ASD that they can feel comfortable around my child or your child if they're not comfortable at all? I think this one's appropriate for the EF&P team. So if one of you guys want to take that one. Maybe Melissa or Keone.
I would say let's let Christy answer that one because she has a personal experience as well as being a systems navigator.
Hi, Lindsay. Could you repeat the question for me?
Yeah, of course. How do you explain to others that don't understand ASD that they can feel comfortable around children with it? Like what is a way to relate to the children if people are not familiar at all with the?
Well, I think it just depends. I think as Lynette had said, one person with autism is one person. So I think when you have a family member that has ASD, there's, again, different characteristics, different things that they may struggle with. It may be that social interaction. It may be space. It may be a sensory thing. Sometimes kiddos have needs to touch, or so when you have and you're in a social environment, and even at the job with recreation programs, we have understanding that those things are not personal. So if they get in a space or they don't like you in a space, there may be behavior actions that come out, whether it be pushing away or being too close. I guess for children who don't have ASD, it's really just important to explain that that's not a personal thing. They have a space. We're just trying to, we try to create as much of an inclusive environment, I guess, as possible. So it just explaining education, I guess, is the biggest thing. I think some people, explain, some people have bracelets. Sometimes it's a universal sign, the puzzle pieces, kind of help people if you're going to be in a social environment. I know a lot of the activities we have It's really just about education, and no two people, have the same exact characteristics. So it really just depends on the environment and how well it's understood, and then how young even the child is, and how much you can, modify and redirect behaviors, which may or may not be appropriate for different environments. So it's really a case by case, but I would just say education is the biggest answer.
Yeah, that's good advice. Makes sense. Another good question we had come in before the call: what are some gentle ways for professionals to address to parents about potentially getting a screening for their child? And that's really open to any of you that want to address it.
I can take that one, Lindsay.
Thank you.
So I would recommend describing to the parent. So I'm assuming that we're talking about a staff member or another professional that needs to have a conversation with the parent. That might be a difficult conversation for that parent to hear. So I think being concrete, describing the behaviors that are being seen, mentioning, for example, we've noticed that your child is not really using language as a 3-year-old that we typically see. And then just being very neutral in the way we present that. So a general recommendation, when I come across this, I generally recommend parents go back to their pediatrician to have a conversation with them about these behaviors that we're seeing. Sometimes an assessment can be really helpful because it can either help us address issues that can help the child get on track, or maybe there's something else going on that we need to find out about that can help the child long term. Sometimes early interventions can be really helpful. So just that gentle, soft language, because we really don't know. We can't, diagnose as a teacher or as an MFLAC. We're not going to be diagnosing, but what we do want to be is a good detective. And we want to bring the parents into that conversation of being a good detective. What does the child need for services or for interventions? And maybe that's all they need, but maybe there's something else that's a little bit deeper that we can explore.
Yeah, thank you for that. That's good advice. There's a good question in the Q&A, and just as a reminder, if you're on Zoom, you can ask a question for the panel by dropping it in there. You can type it in there, and we will get to it if we have time here. One of the questions was, is this support, and I assume they mean the EFMP and MFLAC program, right? So are those programs provided to newly retired or separated family members as well? So do you have to be active duty to have those services? And you want to address that?
So for EFMP, EFMP is available to any government cardholder, the navigation piece of it. So if they are stationed, or some people are retired near an installation, they want to make sure that they go to their Army Community Service Center and meet with a system navigator so that they can go over all the benefits of being in or continuing services with the EFMP program. And I see Key was about to unmute, so I'll pass the key.
No, you said exactly what I was gonna say. You could take and utilize services after you're out of the military. As far as systems navigation services go, they're able to attend meetings with you as far as IEPs or anything like that. You get the same exact services across the board as you would if you were active duty for systems navigation services.
I was going to say the same thing as well, because as a systems navigator, being a military family, that's what I say. If I have the information, I would never withhold it from you. So even if it's a resource, I may not have a benefit that necessarily you have qualified for, but if I have a resource, absolutely come see us, and we would be happy to pass that along.
Great. And what about MFLAC? Do we have anyone that can speak to that, or should we get back to?
So for MFLEX support, it's going to go 180 days from separation. And then after that, we can refer to Military One Source for a full year.
Perfect. I saw another good eligibility question here. Do you need to be registered with EFMP to request a system navigator?
So if you walk into a ACS center to see a system navigator, they're not going to turn you away. Just like Christy said, they will try to assist as best as possible. However, it is beneficial to be enrolled in EFMP since it is a mandatory program. So if you need, some answers, again, our folks are not going to turn you away, but they will encourage you to enroll at EFMP if you have not.
Yes, and I would like to piggyback off of what Ms. Ram stated. Obviously, EFMP enrollment is for those that are active duty service members. So if you're not active duty, if you're a retiree, you could still receive a service. So no, the answer is no, you don't have to be enrolled in EFMP because service members that are retired are not enrolled in EFMP. So they still receive services. They just won't receive certain services, such as respite care. Respite care is for our active duty service members, whereas retirees will get respite care on the outside community. So that's why we offer support services both on and off the installation. So we could provide them with additional services that may not be eligible for them while they are not active.
And what's the quickest way to get the system navigator information from your closest installation? How do you say to approach that?
I would just say call any ACS, your ACS that is close to you, ask them to transfer you to EFMP. If there is not an installation in your area, we do have USAREC systems navigators that aid those, such as in Wyoming, where we don't have military installations, stuff like that. We have two systems navigators that deals with all of those locations that don't have a ACS in their area.
And remind that group what ACS stands for?
Army Community Service, sorry.
Okay, that's okay. Perfect, because I saw another question in there about someone from Texas asking. So Texas ACS is what it sounds like. Yes. Okay, perfect.
Or if they're at a joint base, then it would be the Military Family Readiness Center. Also, right after this webinar, you can go on Military One Source and find where there are ACSs in your location. And if you call the 1-800 number, I believe they will give you the number to the EFMP to EFMP office.
Perfect. Here's one that's specific to how MFLAC and EFMP work together. It was a warm handoff question, and I've lost it in the list here. Give me 1 second. Here it is. What is the most effective way to conduct a warm handoff from MFLAC to EFMP to ensure ongoing care? So do the two programs work together often, and is there a suggestion for that?
So in my experience, when I have referred to EFMP, it can be done in multiple ways. So there is an EFMP at the joint base at the med group. You can bring the family member to the med group and then bring them to the EFMP, or you can provide the contact information as an MFLAC. It just really depends on the family's comfort level if they want you to do the warm handoff with them present. I hope that answers the question, Lindsay.
Yeah, I think that's a great advice. Does anybody want to add to that, or do anybody have different experience there? I think you covered it though. Just want to give people opportunity. Okay, great. All right, let's look through the questions here. What are some behavior modification techniques to use when responding to a student in crisis? So this is again in a professional setting, maybe a school setting for younger kids. Is there anything specific there?
Well, within the MFLAC scope, right, we can provide support to the teacher, and in moments of crisis, what I've done and what I know my peers have done is focus on the other children, which frees up the staff member to address the crisis, because we as MFLACs, we are not in the crisis mode. In terms of behavioral modification for MFLACs, we can't provide behavior mod. We can make referrals to treatment providers such as, ABA or other behavioral therapists. But in the moment in a crisis, the best thing an MFLAC can do is say, hey, I'll go grab a book and read to these friends over here while you address, the child with the needs.
Is there an EFMP perspective that you guys would like to share?
So we don't provide behavior modifications, but when we are going into the school system with families, they actually create BIP plans, which is a behavioral plan that they set in place, and we help guide them with interventions to, best be able to assist that family doing a behavior plan that they're trying to create. So we don't actually do it ourselves, but we give them information that they could use when they go into the meetings with the teachers.
Right. And I think that's worth mentioning too about, both of our programs. I think it's made clear, but just to restate the obvious, that MFLAC and EFMP are non-clinical, and they provide resources and referrals and support. And it's more of a counseling sort of service there for both of our programs. And we also do provide an ASAC. Someone had mentioned and chatted me about it. So ASAC is another program. We have adolescent counseling. I'm going to butcher the acronym. So I think as a resource after the call, we will get information on that program as well that has more direct autism resources available for you and for children in DoD schools. We have time for a couple more questions, so I'm going to go down the list here. Here's one. What are the most helpful qualities an MFLAC can bring into the session with family members of people living with ASD? And what type of support do you feel means the most? I know that's sort of an open-ended question, but who wants to tackle that one?
I know that Lynette had touched on this a little bit before, but just being open-minded and understanding that this family is experiencing not only the stressors of military life, but also what Christy was sharing is all of the emotions a parent feels when they're fearing there's something wrong with their child, and all of the dreams and concerns they had for their child. They're so worried that they're not going to be able to meet their potential. So just being open-minded and being aware of what you can do as an MFLAC. I can provide them support. This pair of people who love their child so much, they want to help them. So help empower these parents to support their child, empower them to work together as a team, and do the best that you can to work and support the family unit while maintaining scope and knowing you cannot directly support this autistic child.
Can I just add too, that was great, Amy. I would just say too that, the family, the parents may be dealing with some guilt, because when you have a special needs child, sometimes you never feel like you're doing a good enough job because the need just continues. And so really, like Amy said, building them up, empowering them, and just problem solving, directing them to, there's a ton of community resources, there's state provided respite care, there's installation provided respite care, just helping them have places to go. So just educating yourself as an MFLAC so that when they bring up a need, maybe the primary care person is tired a lot. Maybe that respite care would be really helpful. Maybe connecting them to other parents, groups with EFMP that are dealing with the same situation, or maybe problem solving with their marriage because it's under some stress. So I think just doing what we do well, and that's showing compassion, problem solving, not coming in with a prescribed idea of this is what the family needs, but understanding that this is really probably a loaded session because they really want to help their child, and they don't always know the best way to do that.
That's great advice. I think we have time for probably one more before we wrap. So this one, what sort of educational support, if any, does EFMP provide to families that have a multitude of barriers?
And you said, I'm sorry, can you repeat the question?
Does EFMP provide any educational support? Is there any trainings or just resources that you have there to families that have a lot of barriers for getting ASD care for their members?
So the first thing any family will want to do is contact the system navigator. They will actually do a family assessment first to figure out exactly what's needed, and then they will do a gold centered type of evaluation. And so in this, based off of what you've what information you have added or you have completed on the forms, they will then, walk with you, either providing advisements for group support groups, workshops. They have outreach events, obviously office visits. They provide resources to community type support groups. So I think the main thing is to go and speak with the systems navigator so that they can get a full scope of everything that you need.
Great. Okay, well, thank you all very much for that. I am going to have Kaylee bring up that last slide again so you can get the contact information on where you can find this replay. Of course, we will send it out, as I mentioned, the replay along with the presentation for today, and you can get the recording there anytime. Please do check out our other resources on the blog, and that's mfed.info/inform. And you can use that QR code there to go to the site and subscribe. And then that way you'll be the first to hear about any of our future events. So thank you all for attending. I hope you learned a little bit more today about what resources are available for ASD families in the military. So if you have a question you forgot to ask, or you want to learn more from our experts, please contact us at that email that I mentioned. So enjoy the rest of your day, and thank you again.